just... Is there still an echo, though, dude?
Yeah, it's easier.
Dude, did you check the output of your thing?
Yeah, it was fine. The filtered microphone, and it's not muted, but I can try to mute it again. Try again. No.
I'll be right back.
See, why is it echoing? It's going through his phone and coming back, right?
His speaker is on.
Is your computer speaker on?
It is, yeah.
No,
Can you turn it off?
Turn it off, turn it off, turn it off.
Yeah, hold on a second.
All right, talk to us now.
Yeah.
Perfect. All right.
There we go.
All right, we are live. We're watching the sunset here. This is Dr. B, Dr. P, and we are in the beautiful Pennsylvania sunset.
It's beautiful.
I wish
nice.
I wish we'd have 6 more hours with the driving, but what we're going to start off with is
More like 8 hours.
our daily beatdown by Holly about what we've been eating and not eating, and then we're going to talk a little bit about BPH, and then we're going to show you a little video about some new medical apps that Dr. Hall is a part of, as well as our friend Dr. Kutnikov with Visible Health. But we'll start off with Holly. Holly, how you doing?
I'm wonderful. How are you guys doing?
You watch us on CBS New York today?
I did not. I have been actually out of touch today. How was it? How did it go?
It was pretty good. It was pretty good. It's pretty good. Raising lots of awareness. People are very interested, and we're very excited to go to Cleveland and then Detroit tomorrow. And then we go to Indianapolis, and then we go to Chicago, and then we go to Minneapolis, and then
Phoenix,
I'm getting chest pain thinking about this, but Phoenix, and then LA. So we got 5 more days to go, so we're pumped.
You're almost there.
So Holly, tell us, we've had some stressful moments the past few days, and sorry, it's a little bright, so
Yeah.
I'm trying to stay out of the sun. But stress-related eating, and David, you can chime in on this as well if you're doing this as well. But we've had some stressful moments, and you know, sometimes a little ice cream is not that bad.
Yeah,
I mean,
sometimes when the going gets tough, the tough get eating.
yeah. So,
It's
what
true.
is a good, like, can you tell us a little bit about when we get stressed, how can we eat something that makes us feel good, but at the same time isn't hurting our belly?
Ah, that's a good question. Well, it's always a good idea to figure out what your body's reacting to first. If you are craving those sweets, maybe choose a fruit instead of ice cream, because that still gives you a little bit of sugar, but it may not curb your sweet tooth. Sugar-free candy is always an option, but you got to be careful, everything in moderation. I think if you absolutely have to have some sort of an ice cream, to choose like a junior size, you know, one of the smallest ones they have.
Okay, we got small.
Good, good. Just get a little tiny bit just to get that fix out of the way so that you don't binge eat and eat, you know, 4 large ones. Everything in moderation.
Wow. That's good. We thought you'd yell at us today.
No, not at all. Hey, we all fall off track.
Good.
All do. What kind of ice cream did you get? Where'd you guys go?
We went to Dairy Queen.
Dairy Queen, we got a blizzard.
That's one of our weaknesses too. I will admit it. I will admit it.
But Sidjo got bananas in his, so.
Hey, there was fruit somewhere. Yeah.
There was some pineapples in there too, right?
It was some
Oh,
pineapple.
there you go.
David, do you like Dairy Queen, bro?
I do, yes. We were there yesterday.
Oh yeah, what's your favorite blizzard?
You know, it's a good one. I like the Twix. It's pretty good. I didn't get.
Oh, it's so good.
I did not eat the Twix Blizzard stuff.
Yeah.
That was good yesterday.
I don't know if you guys saw my posting
Perfect
yesterday.
for today.
I don't know if you guys saw my posting yesterday evening on the portions of
Yeah, the onion rings.
Oh my god!
That was huge.
Oh my god, that was crazy. It was
Yeah,
bigger.
no wonder there's an obesity
It was big,
epidemic.
It was bigger than my face. I was like,
Yeah.
wow.
I was wondering
That was
why your
yeah.
tummy looks bigger today.
Oh, that's so mean.
So, you know, stress eating, it happens much more often than we want it to, especially on road trips like this. It's so much easier to grab a bag of potato chips or get a blizzard. And I agree with you, Holly. You got to figure out what are those stress triggers.
Mm-hmm.
So men overall, have a lot more anxiety, a lot more depression, a lot more mental health disorders. And tomorrow we're going to try to get a psychiatrist on to talk a little bit about this. But I agree with you. There is a big push to eat better now. There's a lot of weight loss clinics out there, Heidi. Like they're opening up everywhere.
Call me Heidi again.
Holly. I said Holly. There's a lot of weight loss clinics out there, and they're opening up everywhere. I just don't understand. Is everyone doing the same thing? And why are they just popping up everywhere?
I think there's a lot of people that are overweight, to be honest with you, and there was a big. What? What did you say?
What's that?
He's there.
No problem.
Oh, he's on the phone. He's on the phone. Where we live in Polk County, I don't know if you guys are in Polk County or Orange County. We are like the fattest county in the state of Florida. So we have the most number of obese people in the entire
Are you serious?
in the entire state of Florida. So we really need to focus on this. But I think the way that my mom describes it is everybody eats, so everyone thinks that they're an expert in eating. Now, there are some things that help people, and there are some that don't. There are many factors that are involved with gaining weight, not just how many calories you eat and how much you exercise, but there's plenty of other factors like your genetics, your food allergies, toxicities, your hormones, your thyroid. There's so many other things involved. So it's important to, of course, start with the calories and exercise, but if that doesn't work, to find somebody who's actually trained in this stuff, not just some doctor who did a weekend course and is now selling diet pills. There are many of other doctors who really are trying to look at it in a different way, approach medicine in a different way.
I agree with you. And then a lot of these clinics end up putting you on medications that are appetite suppressants. What is your thought on using that?
Well, we started off as a weight loss clinic about 8 years ago, and we did dispense a lot of appetite suppressants at that time. I think that they can be used as a crutch for a little while. I don't think it's something that people should use for an extended period of time. After being around it for so many years, for almost 10 years now, I think it's better to try to do it without appetite suppressants. I think that people kind of become not necessarily dependent, but they think that they really need appetite suppressants in order to control their appetite. But if you teach them from the beginning, you really don't, then they learn that you really don't have to take this. There is a better way.
I mean, to be very honest with you, I'll be very upfront. I got into the whole Garcinia phase, Garcinia Cambogia or whatever, and I ordered a bottle. I was eating like 6 pills a day, and honestly, I felt like I think there is some stimulant effect to it. I felt like I was eating more actually, because I was like, oh, I can eat more because I'm taking these pills. But I mean, I think it may just be my personality where if I am like really excited and hyper, I want to eat. So these things for us are not, they're not always the best thing. So, Holly, thank you so much for chiming in with us today. And stress eating, we're definitely trying to control ourselves. And Holly, you're welcome to stick around. We're going to talk about an awesome new treatment for enlarged prostate with Dr. Hall here. How do you have any questions for us?
Yeah, hey, Dave Hall here. Hey, I lost the call.
Oh,
Yes,
sorry about that.
No, thanks, buddy, for calling back.
All right, Dave, what's up, bro? Can you hear us?
I can hear you. I missed the Garcinia.
Oh, you missed the Garcinia thing. I was basically saying I took some, and I thought I was eating more. So
Yeah.
it's a fad. It's been proven to be a fad.
Oh yeah. Well, there's a lot of studies, that suggest, the low sugar options and sugar substitutes lead to, overeating. So I think that definitely plays a factor.
You're right. It does say that. It says if you use things like those sweeteners, you think you can eat more, and then
Like trick you into, yeah.
Exactly.
Absolutely.
But also it keeps you hungry because you don't get that sugar that you need. So I've actually,
Correct.
I haven't fully gotten away from. I'll like split them 50-50. And what I realized, I'm drinking less coffee, and I'm actually drinking less coffee, and I feel fuller afterwards. So there is definitely some science to it. So speaking of big problems, obviously obesity is a big problem, but enlarged prostate is a big problem as well. And there's so many millions of men out there with this problem, like enlarged prostate. As you get older, prostates get bigger. And a funny story, we've been doing some media, and I never thought a few days ago it was me, Sidjo, and the anchor in the urinal starting to pee at the same time. And you could tell which one of us was the oldest one because that person took the longest. I was already done washing my hands. So it was so funny. It was like, I wish I had a camera. Like, I'm like, can I take a... Obviously, Sidjo asked if he could take a selfie, and the guy's like, no.
Definitely a correlation.
So a lot of people confuse BPH and actual prostate cancer. Can you tell us a little bit about what the heck is BPH and why is it such a big problem?
I mean, it's such a big problem because almost inevitably with age, males, our prostates enlarge, and a lot of that enlargement is around the urethra, the tube that we pee through. So that obviously leads to getting up at night to pee frequently, 1, 2, 3, 4 plus times a night. Weak stream that you mentioned in the bathroom there with the news anchor. Having a double void, go to the bathroom right after you just left the restroom, or even in severe cases, infection, bladder stones, complete retention where you can't pee at all. So it's obviously as guys get older, more alarming concerns for us.
So BPH, big prostate now, some of the symptoms now, goes to your report.
I think the system called the urologist, but I think a lot of times they either don't seek care or they don't realize that there are easy options such as pills or even office-based procedures that we'll get to shortly that can give them huge symptom relief. So while that's absolutely necessary, I think it's far more underutilized than most guys think.
Mm-hmm. Now you mentioned some intervention. So obviously there's behavioral things you can do, and then but how do you differentiate your prostate is not enlarged from cancer versus just BPH?
Yeah, I mean, I think that aspect is where a urologist or a family physician or something can come into play, where the routine rectal exam, the prostate exam, and then the blood test, the PSA, come into play. And those two tools really help you screen the guys who might have symptoms from prostate cancer or just prostate enlargement.
So we had a great talk on that earlier today by Dr. Stacy Loeb on active surveillance and screening. So let's say they've been diagnosed with BPH. Now, I usually start medications first. I'm sure all the guys out there have seen the commercials for Flomax or Daily Cialis or things like finasteride, Proscarb, Testasteride. But I find it really hard. I would love to see how you tackle this. Is I tell them that you're young, especially the young guys, 50, 60, 70, is that if you do surgery, you may not ever have to be on these pills, but it's so hard to convince them into that because they think surgery is such a big deal. I think it is, but I don't think it is at the same time. But what are your thoughts on that, David?
Yeah, I mean, I think, like you said, it's tough to talk guys into more aggressive options such as surgery, rightfully so. So I think most guys, if they're not really bothered and they're emptying their bladder well, they're not having any real complications from it, just watchful waiting for BPH is fine. But as their symptom scores increase or they retain more urine or have other complications like infections, that's when medications usually play a role. And I leave it up to guys, there's some guys who can't stand the thought of taking medications, can't remember to take them, or have side effects from those, and then they're interested in perhaps other procedures, but maybe not quite yet as aggressive as quote-unquote surgery. And then there's, so that's when I usually will at least offer them one of the latest, options such as the UroLift by NeoTrack.
What is that?
Hey, I lost you, man.
you hear us? Hello?
Yeah, hold on. I got somebody trying to call me.
Oh my God! Priorities.
Popular guy. That was the drive for women's health. So, hey, back to the drive for men's health. They're still trying. Here,
No,
let me
go ahead and
define
talk
that.
to him. We want to hear your conversation with him.
No. I don't know anything about women's health. So, yeah, the Urolift is a newer technique. It's FDA approved as of this year. And it's an office-based procedure, so not surgery per se, where
Wait, you do it in the office? You do it in the office?
do it in the office, yeah.
Really? Wow, I don't even do it in the office.
Oh, yeah. We give the guys like a Valium, for example, and pain pill, and then we'll put a catheter in their bladder, put a little local lidocaine in the bladder, let that sit about 30 minutes.
Oh,
And then go ahead. You falling asleep?
that sounds horrible. No, I'm just kidding.
Hey, surprisingly, it's very well tolerated, and a lot of guys seem to like that more than the thought of having to go down to the surgery suite or get anesthesia. So the guys have been actually pretty pleased with it.
Yeah.
But basically, instead of removing the tissue, burning it, cutting it, you're just opening that urethra that goes to the prostate, and almost like a curtain. If you open the curtains and you spin them against the windows, you're doing that with the prostate. And like I said, it takes 5-10 minutes just done in the office, and the guys leave usually without a catheter, and they're home the same day.
Yeah, I always tell patients it's like I'm putting like staples to your prostate. Well, not really staples, but like a staple gun, and then putting it. I guess that's not a good way to think about it. I like the current thing. Sounds like
staple gun there.
I like the current thing. The current thing was a lot
That's
more
better.
fun. Yeah.
But the Urolift really is an amazing device, and I really think, like as you said, Adam, I think it's really going to revolutionize the way we treat guys with enlarged prostate.
Mm-hmm. Absolutely. I think especially for the younger guys who are in the middle of perhaps medication and surgical options, it gives us an option that would have fewer sexual side effects, and perhaps fewer risks. And studies so far have shown that it gives them, significant improvement above their medication. So
Yeah,
I think it's just another option that you can offer guys. So it's all about giving options and
I think for most
information. So
for most of these guys too, it's nice because I think one of the biggest issues is the lack of any impact on sexual function. It really has no impact on that. And so when you look at the traditional Roto-Rooter surgery or the TURP procedure, there's a small percentage of guys that really do develop some erectile dysfunction issues. And so for these younger guys, I think Urolift really is, and that's an important deal. And so I think that the Urolift really offers a new treatment modality that, with minimal risk.
Absolutely.
And so Holly, on your end, in terms of prostate health, do you have any specific supplements or anything that you recommend? I know you probably focus more on general nutrition, but have you heard of any specific, supplements, things for the prostate?
Not off the top of my head. I think that's something I'm going to refer to my mom and let her make that decision. Yeah.
That's fair enough.
I'll stay away from all this.
Well, I have a lot of patients that take saw palmetto, and research on that.
yeah, I do too, actually.
And when I was in training, it was like, oh no supplements, FDA not approved. And it's still not FDA approved, but I have got a lot of guys taking it, and they swear by it, and I don't say, oh, get off of it. I just say, okay, well, I can't really recommend it. I can't say yes or no. But if it's working for you, then go for it. Because, I don't know if it's a placebo effect or maybe it's really working. I don't know. But if it's working for them and keeping them away from surgery,
The screen's frozen for me. Can't hear anything. Can you hear me?
Yeah, I can hear you now.
Oh, I hear you guys. Okay.
Anything I want you guys? You there?
Yeah, sorry, we're going through the hills of Pennsylvania.
Oh, that's fine, man. I know them well, so I'm sure that intermittently we'll be lost, but that's fine.
All right, so as we were saying, saw palmetto. I have a lot of patients on it. I don't discourage it, and I don't encourage it, to be very honest with you.
Really?
Yeah, same here.
So
I've seen so much improvement with multivitamins and supplements. If you get the right kind, I think, yes, they are not FDA approved, but there's definitely a difference in quality with ones that you buy from, let's say, a grocery store or a supermarket versus what you can get through a doctor's office. I think you can really get some good effects off of herbal supplements. I know you can. I've seen it happen.
yeah, so I heard about a doctor that bought Garcinia off Amazon.
And it's not me. It's not me.
It's so scary.
Oh, man.
You don't know what it is.
Dude, so I really think Urolift is freaking amazing, man. I've had 5 patients recently, all without a catheter. I mean,
We just had a patient testimonial.
testimonial we did at our takeoff. You know. I mean, I love doing TERPs. I love them, and I still do them. But it takes a little while to recover. I have to put a catheter in them. It irritates them, dysuria. They have a lot of urgency and irritative symptoms persistent afterwards. Whereas with the Urolift, maybe it's patient selection or whatnot, but they're like in love with the procedure. Like they're like, oh my god, I love it. So I don't know what it is about it. I think it is the future. I don't think it's going to be a fad like microwave and tuna. I think this is here to stay.
Yeah.
Is that what you said?
Yeah. Just pretty cool.
You mentioned patient selection, so I think one thing is, the whole median lobe concept. So I know, I described that to patients, and I've had guys who wanted the Urolift, and I just couldn't really do it because of the, the kind of prosthetic urethral anatomy. So that's the one thing I've seen, but I don't know if you've had a lot of guys.
The guy I did it on had, I would say, fairly good sized median lobe, but he would only agree to a Urolift. So I told him, I documented it, and I ended up firing it 5 times, and the guy's doing great. He's doing great.
Okay.
I mean, he's not ideal, but I mean, obviously, all the papers were done on guys with lower median lobes. But what I do find is the guys with the large median lobes or the moderate median lobes do bleed quite a bit afterwards. So I still end up keeping catheters in these guys. I don't know if you have any tips or tricks.
It sounds so crazy.
Be okay.
No, before, you mentioned the median lobe.
No, I haven't. No, I really usually don't. Maybe that is a good idea. Just start them on it, like.
But I think we tend to get a lot of bleeding if you go in and out a lot, right? I mean, so I think as I've done more and more, I think the less you move in and out of that bladder neck area, I think the less traumatic it is. And so far I've been able to get away without putting. I think only one guy I've had to put a catheter in. But you're right. I mean, it sounds like first call might not be a bad thing, right?
No, it's good. I mean, I like it. When we do TERPs with ProScar, it's pretty cool. So, guys, ProScar is a medication that we put patients on that helps shrink the prostate about 35–50%, and Flomax relaxes the muscles of the prostate. So it's kind of combination therapy. But if you get procedures then like Urolift or TERPs or button TERPs, the whole goal is to get you off all those medications in an ideal situation. I think sometimes patients' bodies get dependent on some of these medications. I find it hard to get them off sometimes, but I do try. Well, this is fantastic, Dr. Hall. So how is your bladder flowing tonight?
Feels good. I avoided 3 times before the talk here, so I'm good.
Oh, wow.
3 times?
Yeah, triple voided, yeah.
Oh, my God. You look like you're in a nice hotel, man. What's your view outside?
Here,
Oh. Dude,
that's all right.
Dude, you're like in the middle of nowhere. Where are you?
Yeah, I'm in Pennsylvania, too.
Oh, nice. Okay.
Oh, nice.
Okay.
Nice, yeah.
Well, great, man. Well, it was great chatting with you, bro. Holly, as always, it's good chatting with you, too.
You too.
And we are actually going to be at St. Vincent Fishers in Indianapolis, which is Dr. Hall's stomping grounds, on Wednesday morning, 8 to 9. And Dr. Hall will be joining us there as well. He'll be satelliting in, and he's going to have his whole team there. So we're very excited and pumped to have him there. And thank you so much. You are our local driver in Indianapolis. Like, you are our guy.
That's right.
And you are helping
That's right.
drive that change in men's health. You know, men don't take care of themselves, and you are, just as savvy as we are in terms of social media and getting people encouraged. Are you okay? Take the exit.
You all right?
Hold on. Oh, no, you have to take a local road and then. What the hell, Pennsylvania? The highway just ends, and then now we have to go through local roads to get to the other highway.
Yeah, nice.
Dude, this place is called Sheetz. The gas station is called. Oh my God, is that even legal?
Yeah, they're actually big in Pennsylvania.
Really?
Yeah, you'll see a lot of those, I think.
See, hopefully you don't have to have the sheets.
They have a lot of food that causes the sheets.
The
so, yeah,
sheets.
watch out.
Oh!
Dude, I love that name. This is going to be our new official refueling station.
Oh my God. So,
Refueling station.
Please don't have the sheets.
so David, if you don't mind, tell us about your app.
Yeah, so the app is new. We just brought it out of beta testing. And for now, it just hangs out at, it's tricky, it's app.myurologydoctor.com. And, I started blogging a couple years ago, basically to get information to patients, raise awareness for all sorts of issues, such as men's health. I found patients leaving the office with more questions than when they, more questions than answers, basically. So, this app stems out of my blogging experience with patients, and the whole goal is pretty simple. It's just basically to connect patients with one another around their common condition. So, for example, you go on, you create an account, you create a profile. In that profile, you can put as little on there or as much on there as you want. Part of the profile is your healthcare background. So, for example, I'm a prostate cancer survivor, or I have BPH, or I have erectile dysfunction, whatever it might be. And then you can follow categories. For example, BPH, infertility, kidney stones, prostate cancer. And then within the app, once you create a profile, you can go in these categories and you can find people posting about topics. For example, someone's posting about, leaving the hospital after their prostatectomy. You can message and connect with them to find out their experience.
Oh, really?
So that, if you're, exactly. So the goal is basically connect people. Right now, we've got patients in the exam room 1, 2, 3, 4, and they can't connect very well. So if you think support group meets Facebook meets the whole globe, that's kind of the concept.
So how do you bypass confidentiality with this?
Well, it's an informational tool, and again, the patient and the user agreements, it's basically like a support group online. You go on and you put on there whatever you want. You don't have to put anything.
Oh, really?
They're connecting with each other. They're not connecting with me. It's not for medical advice. It's just for informational purposes and a tool.
Oh,
the
wow.
Platform to connect people.
Is it only for men's health issues?
Say again?
Is it only for men's health?
It is currently, but we have plans outlined to basically roll it out to all fields, all specialties.
Oh, wow. Okay, that's cool. Well, that's awesome, man. Well, where do you see this taking you?
It's taking me a lot of places. So we have a pretty nice outline plan to add premium features. And basically, I see it as a place for all patients to go, not only get information, textbook type information like they find on Google, but to find help, and answers for patient-related information. So, we can tell them what it feels like after UroLift, but another patient can tell them more what it feels like.
That's awesome.
And it's to augment and help with their journey through the clinic and the hospitals and the doctor's offices.
Well, that's fantastic, man. Well, another problem out there is stents. So I don't know about you. How do you track your stents?
What?
Your stents.
Oh, my stents?
Do you have like a stent tracker, or like how do you track your stents? Like, we put in these stents and then patients get lost and they come and cross the stents. Like, how do you track your patients right now?
Oh, track them? Yeah, it's tricky. We basically have a running list. But yeah, no, there's no, I don't have a set program to do that other than a running list.
No, it's definitely.
What's that?
There's definitely a problem. I mean, it's definitely a problem. And we have our friend Dr. Kutnikov. There's a video if you guys want to stick around and watch it, where he talks about he runs Visible Health. He's trying to do a lot of the same stuff you're doing, but he's trying to work on the devices and the technology. So he's the one that his company started Urology Match. I think it's Draw MD. And now they've teamed up with Boston Scientific, and they have a stent tracker. And this is, I'm like, duh, why didn't I think about this,
Yeah.
So
you did a few years ago.
I did.
But,
I did.
Just didn't pull through with it.
But I just didn't push for it like I should have. Now, you guys see this when I play it, all right?
Okay.
Sounds good.
John Seizure.
Can you hear?
Big workout. Hope you guys are having a safe drive. I'm sorry I couldn't do it in person this year, but thanks a ton for letting me talk to you guys about some of the things that we're doing through Visible Health in terms of bringing awareness and helping better manage urologic diseases. As you guys know, Visible Health is really a patient engagement and conversation technology platform that strengthens the relationships between clinicians and their patients. We help individual clinicians and physician groups more efficiently and consistently engage with their patients in their care and really help ensure safety and improve patient satisfaction, hopefully leading to improved outcomes. Our vision is a digital health ecosystem that delivers real, physician-driven solutions for patient engagement, education, and telemedicine that eases clinical practice challenges, empowers patients, and inherently leads to the implementation of evidence-based standards of care. We really believe that such tools will prove to be invaluable assets in the transition to what we're now calling value-based care models and the improvement of healthcare delivery. The company Visible Health first focused on our flagship app suite, which is DrawMD, which many of the listeners may know about. DrawMD allows to visually communicate anatomy, conditions, procedures, and concepts to patients to improve patient understanding and retention, and really to improve the quality of care that we're giving out there. DrawMD now has 17 separate clinical specialty apps. The platform enjoys over 40,000 clinical users and has been used for what is quickly approaching to be 1 million clinical conversations. But what I wanted to talk to you guys about today is a new project that we've recently launched. We all know the saying, never leave a friend behind. And in the world of urology, these things called ureteral stents are considered friends because they can help clinicians and patients get through some really tough times when it comes to obstruction or blockage of the tube that runs from the kidney down to the bladder called the ureter. Now, this obstruction can happen from kidney stones and less frequently from cancers. The stent itself looks like a long piece of cooked spaghetti that spans the distance between the kidney and the bladder. And it basically helps keep the channel between the bladder and the kidney open so urine can pass. The problem is that over 10% of the time, these stents are left behind or forgotten, subsequently removed later than the 6-month intended maximal removal window. So at 6 months, 2/3 of these stents have become what's called encrusted. They get covered by a thick residue of basically kidney stone, which leads to higher risk of infection and often requires additional, more complicated procedures in order to remove these stents. John and Cijo, as you guys know, traditionally clinicians have used logbooks, stickers, note cards, and other means for tracking stent cases, which when done rigorously can be very effective in minimizing the occurrences of forgotten stents. However, many of us in busy clinical practices are really looking for simple solutions and simple tools that can help us leverage modern technologies such as mobile devices, barcoding, and the web to help us keep track of these stents. To this end, we've partnered with Boston Scientific and have come up with what we think is a terrific solution for helping a busy urologist keep track of ureteral stents and make sure that all the stents are changed or removed in a timely fashion. We call it, this platform, the ureteral stent tracker. And we've spent a considerable amount of time designing the system that focuses on ease of use, simplicity, reliability, and most importantly, security. The stent tracker allows the clinician to use a mobile app or the web to quickly capture stent placement at the point of care. You can choose from a list of existing patients or add new patients or have your assistant add patients to your lists remotely. You basically, all you have to do is scan in the stent barcode and the patient gets added to your personal database. That helps you really keep track of a dwelling and overdue stents through the Stent Tracker Clinical Workspace. What we're really excited about is in the future we will have a patient portal which will help educate patients about the stents, help them be educated about the symptoms that they can expect with these stents, and really serve as also a reminder to go back to your physician and have that stent changed or removed. If you're interested in learning more about the ureteral stent tracker, please visit www.visiblehealth.com. There you can also learn more about other digital tools that we're developing in order to improve the clinician-patient conversation. As I said in the beginning, we really believe that such tools will really improve the quality of today's healthcare delivery and will help physicians be better clinicians for their patients. Sijo, Jamin, thanks so much for the invite. All the best on the drive and great work raising awareness for men's health. Take care.
What'd you guys think?
That was good.
Yeah, it's very cool. I like that.
Is this the first time you're hearing about it, bro? Or?
Yeah, I met him at a conference years ago, and I've heard of the Draw app, Draw-MD, but I've not heard of the Stent Tracker. That's the first time I've heard of it.
It's awesome. I think it's going to revolutionize. It's because right now, like, we have a little list in the office, and we try to get them booked, but they still get lost. Especially our practice, where we have a lot of what we call snowbirds, where they come and get some procedures and they move back, during this during the summer months. So I think it's cool, man. I mean, it's cool that urologists are so entrepreneurial, like yourself and Dr. Kutnikov. I mean, it's just awesome.
Well, it's exciting, healthcare, everyone's so down about healthcare, and I think identifying all these problems and then coming up with technological solutions, it's exciting.
It's exciting.
It's great for everybody.
And exciting. I'm glad it's our generation doing it, man, and then we are those drivers, from apps to engage patients to tracking stents to using social media to create a huge movement and a change in men's health. I mean, we're doing it, and I'm so glad. I mean, Sijo and I can't say this enough. We're so glad we have people like yourself, Dr. Hall, and Holly, and Dr. Wickstrom, and Dr. Kutnikov, everyone else getting us there. I mean, we have had so much awareness in just 5 days in almost every city that we've been to. And, I mean, I don't think I could even dream of something like this, in my sleep. So this is really awesome, and the only reason we could do it is because of you guys. So thank you guys so much. We're just driving this car. It's you guys on the ground doing the work.
You guys are doing a lot more than you're giving yourself credit for. You're the ones that are in that car. I'm at home in my comfy house.
I know, and I have to sit next to this guy for that. I mean, after a while,
But it helps when he does these things because that's that much less Katy Perry that he has to listen to.
That's right. That's good.
Well, listen, guys, it was a pleasure talking to you guys, and David, we'll catch up in about 2 days. Holly, I'm sure we'll have you back on tomorrow. And I hope you have a blessed night, and we're going to enjoy this Pennsylvania sunset, and then we'll see you guys later. Thank you, guys.
Get some rest.
Sounds good.
Take care, guys.
Bye.
Bye.